Yes, dear member of jury and hi everyone. It's my honor to be here to present my study entitled Research the Risk of Insomnia, electroencephalography changes and some recent location relating to insomnia in ischemic stroke patient. As we know, insomnia is a common communication after stroke, and EEG help to assess and predict it. Some recent locations are associated with insomnia after ischemic stroke, and we define insomnia as difficulty in initiating or maintaining sleep, waking up too early, insufficient sleep quality, corresponding poor daytime functioning. According to some other in the world, insomnia rate after ischemic stroke were 37.5%, and if untreated, it may worsen stroke outcome and increase recurrence risk. In our study, I have some patients who had insomnia, and they actually had recurrent stroke just a few months later. Study of EEG in the world shows the changes in background activity, a decrease in overall amplitude, and an increase in slow wave activity. These locations are involved, such as frontal lobe, parietal lobe, or that sort of thing. We connected 103 ischemic stroke patients who did not have insomnia before and divided into two groups. Stroke were diagnosed by WSO definition. Insomnias were diagnosed by acute insomnia criteria of DSM-5 and brain MRI used to identify Nielsen location. However, we have only 61 patients came back and were underwent EEG. Our data were connected at two time points. Firstly, during hospitalization, we collected data about MRI of the brain, and at least 1 month after stroke, we collected data about insomnia assessment and EEG finding. From here, we use acute insomnia criteria to identify insomnia and divide the patient into two groups. First, we can see the average age of patient was 62.4 years old, and male counted for 62.1%. And we found there were 35.9% of patients had insomnia. And our results were similar to Nepal Voria, with the rate of insomnia were 37.5%. With alpha waves, we found the absence of spindle shift of alpha wave in 67.7%. And when analyzing alpha wave at tail list, we found the decrease of median amplitude and median index value at some region, especially in the frontal central region in the left hemisphere, in the parietal, occipital, temporal, prefrontal region in the right hemisphere. We also compared to beta wave, but the difference was only observed in the decrease of median amplitude at frontal, prefrontal region in the left hemisphere. Besides, we also found the appearances of slow wave activity in the insomnia group. In particular, the increase of delta wave were observed at the prefrontal, frontal region in the left hemisphere, and temporal prefrontal region in the right hemisphere. With delta wave, we found the increase of delta wave were observed at the prefrontal, frontal, and temporal regions in both hemispheres. Here is an EEG of patient with the right Nielsen location, and the patient had insomnia. So you can see the scattered of the wave activity in the temporal prefrontal region in the right hemisphere. And we expected EEG changes were only observed in the damaged side, but we found the surprising thing. That is some abnormal wave in the normal side. We can see the loss of spindle pattern and the reduction of amplitude alpha and beta wave in the left hemisphere. And that is like a compensatory mechanism of the opposite side. With this location, we also expect that the damage will be on the well-known sleep areas like as thalamus, hypothalamus, or brainstem. But instead, it goes somewhere else. And we find found is the location that is frontal lobe, parietal lobe, occipital lobe, and interlocapsal area. While it also found in functional MRI show abnormal local activity in multiple brain regions, particularly the visual processing cortex, the sensory motor cortex, and the default motor network. And according to the author, overstimulation of DMN and increased sensitivity to sound and visual may be the main mechanism of insomnia after ischemic shock. Here I have some image of patient. The first one, we have the lesion location as the frontal lobe. And the next one, we have internal capsule area. And the next, we have parietal lobe. And the last one, we have occipital lobe. And all persons had insomnia after ischemic stroke patient. Conclusions, we can see the increase of the risk of insomnia and alteration of EEG indicated by the changes in background activity with a decrease in overall amplitude and an increase in slow wave activity. Lesions as the frontal lobe, parietal lobe, occipital lobe, and internal capsule area was the risk of insomnia after ischemic shock. Before I finish my presentation, I really want to say the last thing. Insomnia doesn't kill anyone immediately, but it slightly undermines recovery. So now we know some signs to realize this. We must learn how to deal with this. And thank you very much for your attention.